Welcome. Hi, I'm Jan Marini, the founder of Jan Marini Skin Research, and I am here with Jodi.
Hi.
Jodi works in accounts payable and she also teaches yoga. And we're going to be doing her consultation. So, Jodi, if there was something you could change or improve about your skin, what would it be?
I get acne even at my age, and probably my forehead, lines, wrinkles.
Okay, forehead lines and wrinkles.
Mm-hmm.
Okay.
And I seem to be really oily. And I'm not sure if it's due to the products that I currently use or if that's just my natural skin.
Anything else you'd like to change or improve?
Probably better evenness in my skin coloring.
Okay. So when you say better evenness, do you mean brown discoloration, red discoloration?
No, not really. More from the sun.
Okay,
Yeah.
So from sun exposure.
Yeah, exactly.
Anything else? Pore size,
pores
texture?
are pretty large.
Okay. So you kind of told me already, but let me ask you, do you think your skin is more normal, combination, dry? How do you categorize it?
I would say, I think it's oily.
Okay. Now when you say oily, do you think it's oily everywhere?
Forehead,
Or
chin,
just T-zone?
cheeks, yeah.
The cheeks are oily too. Now, would you describe that as that you have to, like, you at certain times of the day, you look at yourself and go, oh my gosh, I'm just like a spotlight?
Yes.
So it's very shiny.
Yeah, like
very
I
shiny.
need to blot, and
And
that's with makeup.
not just the T-zone, but the cheeks and everything.
Yeah.
Okay.
I need to blot everywhere.
Okay.
Forehead, especially.
Okay, so, but it's definitely oily all over.
Yes. Yeah.
And would you say that it's more so in the summertime, or would you say that
I would say it's all the time.
it's all the time?
I haven't noticed that it's any particular time of year.
Okay. Were you ever a smoker?
No.
Sunbather?
Occasionally.
Okay.
I naturally have dark skin, but yeah, I mean, I'm
But
known to go out
teenager or-
occasionally. Yeah.
But as a teenager, were you a sunbather, or
Yeah,
just
yeah.
okay? Yeah. And when you were a teenager, did you have acne?
Oh yes. I'm waiting to grow out of it.
Well, got bad news for you there. We females can have it our entire
Oh,
life.
great.
But, and was your skin oily as a teenager?
I would say so.
Oily as it is now?
Probably. And my mom and I have very similar skin.
Okay.
And she's also had the same issues.
So tell me about the acne you had as a teenager.
Okay.
Was it everywhere? Was it worse than as an adult?
Probably more so than now as an adult.
Okay.
But yeah, it wasn't cystic or anything like that, but just
Papules, pustules, in other words, you get a red bump.
yes.
And it would turn maybe into a pustule sometimes.
Yeah, kind of like what I have right now.
And was it pretty much everywhere?
Pretty much everywhere. And I was on Accutane. I don't know the dosage, but I was on Accutane for a while.
And that was as a teenager?
Yes.
Okay. So for about 6 months?
I guess. I don't remember it, the length of time.
Do you remember the color of the tablet? Was it yellow?
Yes.
Okay,
Yeah.
so you were probably on 20 milligrams twice a day, which is an average dose.
Okay.
Accutane, which is a form of vitamin A, isotretinoin, is a very, very strong medication, which is absolutely phenomenal for acne. It's kind of gotten a bad rep. It should only be used under circumstances where nothing else typically works, but it can be a real miracle worker. With women, oftentimes women will fail Accutane for a number of reasons, because there's certain underlying causes where Accutane can definitely make the skin better. It can definitely lessen the breakouts. But after you go off it when your skin is really clear, then over time you tend to see the acne come back. Yeah. So we'll talk a little bit about that. But it's dosed according to body weight, and an average dose would be 20 milligrams twice a day. I just happen to know that the tablets are yellow. Mm-hmm. So I'm not a mind reader. But
I was going to say yellow, but when you said it, it was like, yeah, okay, yeah.
Yeah, and you put one in the morning, one at night, okay. And so did you find that your skin did clear up on the Accutane?
It did, but it caused so many side effects that it was kind of not taking it was easier than dealing with the side effects.
Okay.
A lot of peeling of the skin, peeling of my lips. It was,
Okay.
pretty treacherous.
Okay. And let's talk about what you use currently.
Okay.
What do you wash with in the morning?
Peter Thomas Roth.
And which cleanser?
I think it's anti-aging or...
Is it a gel?
It's a gel.
Okay. So it's an anti-aging.
I believe so.
Is there anything in it that comes to mind, like has salicylic acid, anything like that?
Oh, not that I know of. I haven't read that closely.
Okay. And then what do you do after you wash?
I use Proactive. It's like, I think it says some kind of lotion, but it's not lotion. It's actually just something to put on your skin. Actually, before that, I use Clinique toner. I'm sorry.
Okay, which one?
Number 3.
Okay, so you use the one that has salicylic acid and it's the strongest one.
Okay.
Probably the strongest.
Okay. And then I use the Proactive.
Now, the Proactive has got the benzoyl peroxide in it?
I believe so, yes.
Okay. But it's kind of categorized as a moisturizer?
No, I wouldn't say a moisturizer,
So it's more
but
of a
just something.
a treatment product.
Yes.
Is it 2%? 2.5?
I think it's 2%.
Have you felt that has helped your skin?
I do.
Okay.
Yeah.
Okay, good. And then what do you do after the Proactive?
So Proactive, I use an eye cream by Philosophy. I think it's like Hope in a Jar, Renewal Hope in a Jar. It's just for the eyes.
And anything else that you use during the day?
So for the full face, I use either Clinique's yellow lotion, just the regular lotion.
Oh, the dramatically different
Yes,
moisturizer?
yes. And depending on if I'm going to be out in the sun during the day, then I'll use either the Peter Thomas Roth 30 SPF 30 or I think it's 15 SPF 15 by Proactive. So either one of the 3 for a everywhere lotion.
So SPF 30 or SPF 15?
Right.
By Proactive. Now, do you do that every day? Do you wear sunscreen?
I would say probably 80% of the time. It just depends on if I'm just working and not really spending time outside, then I'll just use the Clinique. But if I know I'm going to actually be spending time outside, then I use the SPF.
Okay.
And the 30% if I'm actually going to be out.
So when you use the Clinique dramatically different moisturizer, do you substitute the sunscreen for the moisturizer, or do you wear them both?
I do one or the other.
Okay. And at night, do you use the same cleanser?
At night, I'm not so regimented.
And what does that mean?
That means that on a good day, I will use a Neutrogena little towelette.
So makeup remover.
Yeah.
Okay, and then anything that you do after that?
Not generally. Sometimes I'll put a face cream on, but for the most part, even just getting the makeup off my face is a big deal. So I have to say no.
And in terms of foundation, what brand do you use?
I use, is it Bare Minerals?
Okay, Bare Minerals, the powder?
The powder.
Okay. And the reason that I asked that question is today, most foundations don't have acneogenic ingredients in it. It used to be that I used to have to keep lists around to advise people what foundations wouldn't cause them to break out. But most of them are good. And Bare Minerals doesn't have anything in it that would tend to have any kind of an acneic effect for the most part on most people. So that's a good one. Okay. So let's talk a little bit about the acne.
Okay.
When you break out currently, tell me where you break out typically on the face.
Forehead. Right now I'm the cheek, chin, sometimes underneath my chin.
Okay. So pretty much it could be anywhere.
Right.
And what do you do that you think makes it better, and what do you think makes it worse?
Probably not washing my face at night.
Okay.
I really don't know what causes it. I am thinking it may be stress related or working out and then not washing my face. Yeah, I'm not sure, to be honest with you.
Okay. And where you think you have some discoloration or uneven coloration, where would you say that is?
Maybe just a little bit all over my cheeks.
Okay. So like just kind of like that brown discoloration, sunspots, those kinds of things that we tend to call. And where do you think you have large pores?
Definitely my cheeks. Maybe my forehead.
Okay. All right. So I'm going to ask you another question about the cleanser that you're using.
Okay.
So typically when people feel that they have oily skin, they tend to use cleansers for an oily skin. Okay. And that's not necessarily the category I would put you in, but if you were to use a cleanser for oily skin, what happens? Does your skin dry out? Does it feel superficially dry?
I would say it probably would dry out.
Okay.
Yeah, because I do need a moisturizer after using a cleanser.
Okay. Okay. So, and we'll get more into that. So I want to talk a little bit about the acne.
Okay.
Now, being as you've seen a dermatologist in the past, and you saw the dermatologist for Accutane, of course, have you seen a dermatologist on an ongoing basis at all?
No.
And did anybody ever really get into the acne process with you?
No.
Okay, so we're going to talk about that for a moment. So, I think it's really helpful if you can visualize how acne occurs, and then it makes a lot of sense as to what you need to do to get your skin really nice and clear. Now, by the way, I'm a 2-time Accutane failure.
Oh, okay.
And I had perfect skin as a teenager. Perfect. I developed it when I was 19. And so it's not unusual for sometimes people to be on Accutane 2 or 3 times and then still have a tendency to break out. So there's some other, again, underlying causes. So when you touch the outside of your skin, you're touching the stratum corneum. That's a dead layer. And we shed about 500 million cells a day. You're just not aware of it. It's microscopic. And by the way, that dead layer, even if you have a really oily skin, when you wash your face, because the layer is dead, what happens is that at first it feels nice and soft. But then as soon as the water evaporates, it takes about 20 minutes for water to evaporate from your skin, those cells just kind of shrink up and they harden, and it's called cornification. And as we get older, that happens more and more. So you can be producing oil, but at the same time, feel like your skin can be very dry on the surface. Plus, that dead surface skin can actually absorb oil and hold on to it. So sometimes you can even be more oily than you think you are. I know you don't want to hear that, but it's because it just kind of clings to that dead oil.
Okay.
But anyway, I'm kind of getting away from the topic, which is that you have these dead cells on the surface of the skin. Now, when you look at a follicle opening, you're looking at the opening into a long hollow tube, which is about as big around as the diameter of a hair.
Oh wow!
And if you have large follicles, and I've had large follicles, it's you kind of picture in your head there's got to be this cavern in there. Right. You would never think it's just this like a slender little hair. Right. Now, inside the follicle, it's lined with dead cells, just like the outside of the skin for the most part. And at the bottom of the follicle, you have sebaceous glands. And it's a fallacy to say that if you have oily skin, that your skin is somehow going to be miraculously younger than everybody else. But one of the reasons you produce oil is because these cells inside the follicle shed constantly, and oil just pushes them to the surface. They sit there and they fall off, and that's a normal process. Now, in individuals that have a tendency to acne, we haven't discovered the acne gene, but we think that it's hereditary, the tendency toward it. Okay. And typically you've got somebody in your family that has it, but you could be the only one that does or the only one that doesn't, because it can skip a generation. But for whatever reason, the cells in the follicle stick together. That's the beginning of the acne process. And the very beginning of it is what is known as a microcomedo. Okay. So it's a microscopic clump of dead cells. And you'd need a microscope to see it. And you can actually have these microcomedones sitting in your follicle. And you're not aware of it. They can be dormant. It can take days. It can be weeks. It can be months. You could actually have started developing acne at a much younger age than before it showed up. The average age that females begin to develop hips in the US now is 8 years old. The onset of puberty is defined by breast development, not menstruation. So you have very young girls, sometimes 9 or 10 years old, that are starting to develop breasts. They're in puberty. And so they can have these microcomedones, and then maybe it's not until they're 11 or 12 or 13 years old, they wake up one morning and all of a sudden they're breaking out. But it could have been going on for a long time.
Right.
So if you break out, the term acne is a term that describes a process. If you just get one lesion, that's still an acne lesion. Maybe you get it very infrequently. Maybe you get it on a consistent basis. Maybe your acne is very mild. Maybe it's severe, but it's all acne. And so when these cells stick together, it can progress in several directions. Now, the mildest form of acne is like clogged follicles or blackheads. And what happens is that these cells build up, your follicle literally expands, it dilates, and you see it as a clogged pore or blackhead. Not a serious form of acne, very mild. But it's when that kind of closes over and you've got the cells collecting in the follicle, they're sticking together, they trap oil, and they also trap P. acne bacteria. Now, P. acne bacteria is harmless. If you can have perfectly clear skin and have colonies of bacteria. I have colonies of bacteria, everyone does. And when they're trapped in the follicle in an environment where there's less oxygen and all these dead cells and everything, they thrive because they eat the oil. And then they excrete this fatty acid byproduct. Now, this byproduct is very corrosive. And over time, it wears down follicle walls. If everything stayed in your follicle, you'd never have a breakout. It's when the follicle either leaks, ruptures, or blows out that the inflammatory process, as it makes its way to the surface, you have a lesion because some of the material goes to the outside and your body treats it like a foreign invader. Now, if you have a leak near the top of your follicle, you're probably going to get a red bump, a papule, that may or may not turn into a pustule. That's a fairly mild form of acne, but of course it's incredibly annoying if you have a whole face full of them. If you've got what is known as a rupture, it's like deeper. It affects more of an area outside the follicle, and you're going to get a nodule or a mini cyst, those hard ones, underground ones.
Okay.
And if your whole side of your follicle blows up, you're going to have a full-blown cyst. The inflammation affects the dermis, and that's generally why you get scarring, you get pitting and scarring, almost always with the big cysts. So you've got more of the papules and the pustules.
Okay.
And when you're addressing this issue, you've got to do at least 3 things. Number 1, you've got to introduce something in the follicle that keeps the cells from sticking together.
Okay.
Number 2, you have to deal with the P. acne bacteria. If you can keep those bacteria colonies down at a level where they're unable to eat the oil, I mean, you don't break out.
Okay.
And then 3rd, we need to deal with inflammation because acne is actually an inflammatory disorder.
Okay.
Now, there's actually a 4th area, and this is something that I just want to kind of throw out there because even though you've had acne since you were a teenager, it kind of changes as you get to be an adult. And I can't tell you how many times I have people say, well, I really didn't have acne as a teenager, and it happened in my 20s or my 30s. Or I had it and it went away and then it came back. And when it came back, it was on my chin and my jawline and it was really stubborn. And acne is an epidemic today among women in their 20s, 30s, 40s, and beyond. Now, men generally don't have acne past the age of 23. And the reason why is because they get terminal beard growth. The beard pushes everything out of the follicle. We can have it our entire life. But there is an issue with adult females, and it's estimated about 98% of the time. So not to get too technical, you have certain enzymes in your follicle, and they're referred to as isozyme type 1 and isozyme type 2. You have them in your hair follicles as well. And then outside your follicle, you have lots of hormones. You have estrogen, progesterone, hopefully, and testosterone. Women have almost as much testosterone as men, but our testosterone is bound by proteins, which is why we don't have a deep voice and we don't get a hairy chest, hopefully. What happens is that we find that women with adult acne very often have a mild testosterone sensitivity or they're producing a little free testosterone. It will not show up in a blood test. The blood tests for hormones have a very wide range of normal. So, you can say, oh my gosh, I've got to go to the doctor. I must be having a hormonal issue. It's just enough, though, that when it gets together with those enzymes in the follicle that are harmless, when they meet each other, it produces dihydrotestosterone. And it's instant acne. Now, usually, and I'm not sure this is really what's going on with you, because usually what happens, it's the larger nodules, and it's in the jawline and the chin area, and it's very stubborn, and women didn't have them as teenagers. But it's so frequent. And so what you typically have to do in a situation like that is you typically have to do something that blocks these two from getting together. Antibiotics are anti-inflammatories, and they also kill P. acne bacteria. So while you're taking them, oftentimes skin clears up. Then when you go off of them, it comes back. And particularly if you don't address that issue. Now, if that were your issue, then I would say one of the things that you might want to consider at some point is to see your physician and say, Doc, I need, and this is something that interestingly enough that blocks it, is a diuretic. It's a prescription diuretic that's been around about 50 years called spironolactone. S as in Sam, P as in Peter, IROLACTONE. And it's given for high blood pressure, congestive heart failure, those kinds of things. But in the case for adult acne, female acne, it's given in very low dose, like maybe 50 to 150 milligrams. And all it does is it pretty much kind of puts a wall up so those two can't get together. It cuts oil about 60 to 80%. It doesn't dry your skin, it just normalizes it.
Okay.
And also, because it blocks the enzymes up here as well, if a woman is going through female pattern baldness, about 50% of all women will have hair miniaturization or they start to see hair thinning. It takes care of that.
Oh,
anyway,
nice.
it's something to keep in mind, and that may not be your issue at all.
Okay.
But I think it's important to understand why there's so much adult acne. Now, there's one other thing that I also want to mention. We do know a couple of things that can be causative factors. And milk has definitely been indicated as a causative factor.
Okay.
And this is a study, and I don't know if you're a big milk drinker,
I'm not.
but this is a study that was done and presented in the American Academy of Dermatology on 47,000 nurses. Then it was repeated on their sons and daughters. And then they did 2 other studies of 6,000 each on teenage girls and boys. And it's not because we give hormones to cows. It's because whether you buy your milk at Whole Foods or wherever you buy it, it doesn't matter, what the quality of the milk is that they keep cows pregnant and they continue to milk them.
Mm-hmm.
And normally in the wild, a cow would completely stop nursing as soon as it gets pregnant. But we milk them, and so if you have milk tested in a lab, you'll find that it's full of steroidal hormones. So it's definitely a causative factor. The other causative factor has to do with the glycemic load.
Okay.
Now, the glycemic index is an obvious number that you assign to food. Like, okay, let's say you have a Snickers bar, and you say, well, obviously it's going to have a high glycemic index because it's got a lot of sugar. And you look at a piece of whole wheat bread or something, and you say, well, that's got to be lower because it doesn't have the same high sugar content. The glycemic load, though, has to do with how your body deals with the food once you ingest it. So, for example, and this is really interesting, you could have the best slice of whole wheat bread you could possibly imagine and a 1/4 cup of sugar, and the bread is going to have a higher glycemic load. And so over time, where we eat lots and lots of carbs and we have a higher glycemic load and our insulin levels are not stable, what happens is that when those insulin levels keep going up, your body may start to produce testosterone to bring them down.
Okay.
So it's something to keep in mind. I don't know, you may have a very low carb diet, but we're finding more and more that it's really helpful when you have a low carb diet, that it really does help with inflammation and acne and pustule count. Okay, so that's something to keep in mind. So anyway, what we have to do is we have to introduce something in your follicle, number 1.
Okay.
It helps to keep the cells from sticking together. And we have to deal with that P. acne bacteria. And the good news is those substances that we use today for that also are phenomenal for making your pores look smaller.
Oh.
And the skin just look really smooth and really porcelain. Because some of these things are the same things that I would recommend to somebody who is saying, oh, my pores are fine, but I have fine lines and wrinkles, or those kinds of things.
Mm-hmm.
So we're going to be working on that, and I'll come back to that more in just a moment. I also want to talk about, you talked about where you feel like you have maybe fine lines, and you mentioned the forehead. And is there any place else besides the forehead where you feel that you might have fine lines?
The eyes and definitely my laugh lines.
So when you say eyes, are you talking like crow's feet?
I don't know if it's so much, it's the under eye circles and the fine lines, yeah, so crow's feet.
Okay. And you mentioned like your nasolabial folds.
Yes.
Okay. So 90 to 95% of what we perceive as inevitable aging, you look in the mirror and you say, okay, well, everybody gets old at some point. We have lines, wrinkles, brown spots, etc. Is sun exposure. Right. And most of it happening before the age of 10. At least 50% gets programmed into the skin by the age of 20. So those are the textural changes and discoloration and pore size and, all those kinds of things and little fine lines. Then there's something called dynamic muscle movement. A dynamic muscle movement, and you may know this. Okay, so I always say if you lived in a cave and you never had any sun exposure, but you make expression lines, you go like this,
mm-hmm.
and what happens is certain muscles work harder than others, and it creates a crease in the muscle. You put the skin over it, you see a line. And that's Botox. Now, I'm not selling Botox, although I should get a commission because I talk about this a lot. But just so people know, we can soften the appearance of those. Really, you can, but you just, you can't make them go away. And so what Botox does is, unlike people joking like, oh, okay, it paralyzes your face. What it does is it simply will have less. Some muscles will stop working the way that as hard as they were, and kind of scrunching up, and other muscles will take over. And so it's for this area, it's for this area, and it's for this area. Now there's other areas as well, but those are the primary areas. Okay, nasolabial fold is a different issue. Now again, we can actually help with the appearance of contour of the face and make it look firmer and make it look more lifted. But what happens is, and this is what we call intrinsic aging. So intrinsic aging is about 4% of the aging process, but it's like, kind of sometimes you almost wish that you could just deal with the 95% instead of the 4%. But part of what happens when you age is that the cheek pads move down. Okay. And the most feminine facial characteristic of the female face are cheekbones, not just because they photograph, but because they define femininity. And so there's something called the youthful triangle. So the youthful triangle is where the highest point of the face is the cheekbones, and then it narrows down into a well-defined jawline. Actually, the ideal face shape is really more heart-shaped than oval, because that's that high cheekbone and it narrows down. So as we age, the cheek pads tend to move down, and you start to see a nasolabial fold, a smile line, a nasolabial fold, and eventually the widest part of the face is the jawline, and this is actually narrower. And this is one of the reasons why, as we females age, we become more masculinized in facial appearance. Men, same thing happens to them, but if a man becomes more masculinized, that's no big deal. Right. And I always joke and I say that we think about this. I mean, if you think about this, you'll know that what I'm saying is correct, because if you've commented sometimes on maybe an older couple that have been married for 40 years and you say, oh my gosh, they've been together so long and they start to look alike. It's because the female starts to take on the facial characteristics of the male. So again, there's some things that we can do that can make a difference. And one of the reasons why this occurs is because 50%, as much as 50% of what we put in that sort of intrinsic aging category is loss of volume. Okay. And that's hyaluronic acid. So when you're born, you have a huge amount of hyaluronic acid. It's one of the reasons why babies look so fat. It gives your body a lot of substance. It's the common denominator in aging among all species, whether you're a bug or a human being or a horse or a cat, is loss of connective tissue. So we're kind of shrinking, and that hyaluronic acid that gives the body volume, we produce less of it, and sun exposure doesn't help. But particularly when you get into your 20s and 30s and beyond, you're producing a lot less. That's one of the reasons why injectables are so popular, because you can lift the face, you can do different things cosmetically, but it starts with skeletal volume. That three-dimensional volume is very, very youthful. So that's something that we can make the skin look more volumized. And one of the ways that we do that is hyaluronic acid is that primary ingredient. But hyaluronic acid, traditionally, when you put it on the skin, it holds about 1 to 10,000 times its weight in water, which is great. But it's very, very short-lived, and it just sits on the surface. Well, now we have these tiny little molecules that actually penetrate. It's a game changer. So that's something that we can think about for you. And the great thing about that is, at least the way that I formulate with it, is that you can't feel it on the skin at all.
Oh.
So when you're using it with your products, you don't feel like you're wearing another layer.
Right.
So, what I'm going to do today is we're going to put you on a system. We're going to put you on the basic skincare management system. Okay. And I am going to, I think, start you off probably on the normal combo system, even though you say you're very oily. Okay. Because I really believe that as we kind of see where your skin settles in, that you're going to be maybe more combination. And what happens when we get past our 20s and we get into our 30s, etc., and I don't know how old you are, so maybe you're still in your 20s. But
double.
But what happens is that you have to be very, very careful about removing too much oil from the surface of the skin. Okay. And it doesn't really, it's not going to help with breakouts. Because oil is not what causes breakouts. You can have very oily skin and not have acne, and you can have very dry skin and have acne. So I think that your skin's probably going to maybe settle down a little bit, and we'll kind of see where it's at. And so what we're going to be doing is a skincare management system. One of the products in here, and this is something that you're absolutely going to love, is called BioClear. Okay. BioClear is a combination of glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for rosacea, sold by prescription for acne. It's also one of the best resurfacing agents we've ever seen for the appearance of follicles. Helps make the skin look brighter. And when you put it together with glycolic and salicylic, it is the best resurfacing agents I've ever seen for exfoliation and just making the skin look like glass. But it also helps with the appearance of the breakouts. Okay. There's some other things in here that are going to be really, really helpful for your skin. And then I'm going to have you using something called Duality. Now, you mentioned that with Proactive you use some benzoyl peroxide. Mm-hmm. This is going to be very, very different than what you're using. But benzoyl peroxide is the best thing we have ever seen for acne in terms of any type of topical medication, and even works better than a lot of antibiotics. Because what it does is benzoyl forces peroxide into the follicle and releases oxygen. P. acne bacteria can't live in oxygen. It kills it better than anything we've ever seen. Oh. And if it works for you once, if you're using the right percentage, it will work for you forever. You don't develop a resistance. Okay. And so this is going to be stronger than what you've been using.
Okay.
And this is also combined with retinol. So that's another gold standard. That's retinoids that are used for acne. And we're just going to do some overall skin conditioning, and I think it's going to make a huge difference in the texture and just the appearance of pretty much everything that you've mentioned.
Okay.
Yeah.
Great. Thank you.
So do you have any questions for me?
No, I don't think so. I mean, I just want clearer skin and,
Well, one of the things that we also are going to be adding into your program is I'm going to be probably adding in the Luminant Facial Lotion. I have to think about exactly when, because that also is tremendously anti-aging, but it goes after discoloration for that even skin tone. Okay. Now, Part of what you're experiencing with the discoloration, I believe, is that when you have breakouts and your skin comes in contact with UV radiation, you tend to have post-inflammatory hyperpigmentation of pigments to protect itself, for one thing. And so you can get brownish, purplish, and just different types of discoloration, which also we can really help to go away a lot faster.
Okay.
So I can't wait to see what happens.
Thank you.
Yeah. Are you excited?
Yeah.
Great.
I'm willing to do anything.
Well, we'll keep following up, and I also want to emphasize that somebody's going to be checking back with you in about 4 days.
Okay.
And then I'm going to be talking with you in a couple of weeks and 2 weeks after that, because really it's so important that you constantly evaluate your program. You want to make certain that if you're looking for specific things that you want to change or improve, are you meeting those targets? And also, sometimes programs need to be modified. It could be the time of year. It could be lifestyle changes. And as you get older, different things happen with your skin, so you may need to address different issues or new issues. So even if you tell me a month or 2 months from now that your skin is the best it's ever been, I can get it even better.
Oh, okay.
So I want to thank you for watching. Please subscribe. I'll see you again later. Bye.